Good afternoon. My name is Mary Turner. I'm president of the Minnesota Nurses Association. More importantly, I'm an ICU nurse at North Memorial in Robbinsdale, Minnesota. I want to be very clear about this legislation. This legislation is about protecting patients in Minnesota. Our patients are waiting hours and days in the emergency room to be admitted. They're being treated in beds in hallways. Patients' falls, bed sores, even deaths are increasing by 33% last year, according to the Minnesota Department of Health. All of this is happening because our hospital executives have failed to staff enough nurses, and they have failed to retain the nurses that they have. This is the crisis of patient care that already exists in our hospitals. It is a crisis those executives created and have failed to solve. Now, those same executives are trying to claim that having enough nurses to safely care for every patient will hurt patient care access. How does that make sense? It doesn't to us, and it doesn't to the public. This year, for 21 years in a row, we have been ranked the most trusted profession in the nation. And as a member of the most trusted profession in the nation, I tell you that this staffing crisis that they say can't be solved through this legislation, that's inaccurate. We believe that if we can find a way through this legislation to improve the conditions at the bedside, nurses will come back to the hospitals. Right now, they are actively doing everything they can to make sure that we don't stay at the bedside, and we reject this. The public trusts us, they trust the nurses, they stand with us on these issues because they've experienced firsthand the quality care nurses at the bedside, and because they have just seen how bad things are getting. You know, even 10 years ago, when we were out on the line in 2010, it's even different than it was a decade ago. Now I say to people, it's different because the patients are now seeing the difference. They're seeing the nurses that are leaving the bedside. They are seeing how their wait times are longer, how their call lights aren't getting answered. And so that is why the public is on our side. And so they've heard us, they trust us, and we are so grateful to the legislature that is bringing this forward as far as it's ever gone. We've been at this fight for over a decade and a half. And so we are so grateful. But I want to bring up a few more nurses to give a few more points of view, but just telling you that this will not hinder nursing patient care at all. It will not keep patients from getting help in the hospitals. That is what this is not going to do. I will now bring up Becky Nelson, our chair of our government affairs.
Thank you, Mary. Good afternoon, everyone. My name's Becky Nelson. I'm a registered nurse at Alliance Abbott Northwestern Hospital, and I work in peri-anesthesia there in surgical services. As the chair of M&A's Governmental Affairs Commission, I can tell you that this is an absolutely historic day. We have been coming to the Capitol for more than 2 decades asking for something to be done to solve the crisis of understaffing in our hospitals. And today, for the first time ever, the Minnesota Senate will vote on legislation to do that. Without action, the problems are really only getting worse in our hospitals. Nurse reports of situation where short staffing negatively impacts patient care have skyrocketed to more than 8,400 last year. And more than 50% of nurses are considering leaving the bedside due to short staffing. 2,400 M&A nurses left bedside jobs last year. And this issue is really personal to me and these nurses. We are overworked, we're overwhelmed, and we're devastated at the impact of what short staffing is doing to our patients. We want to provide outstanding care, but we're being pressed by hospital executives and corporations to do more and more with less and less. I know many RNs who have left the bedside for lower stress outpatient positions in the last few years. I know many RNs have reduced the hours that they're working because of stress, and I know some who have left the workforce entirely. Some of them are here today and are not employed. Personally, I've stayed on the job, but not without some serious health consequences. I've had some depression that has required medication. I have lost some hair. I've experienced stress-related hair loss. What we have right now is a crisis of retention and a crisis of patient care. Every patient deserves to walk into a hospital and know that they will receive timely, high-quality care. The good news is that more than 80% of nurses who left the bedside last year indicated a willingness to come back if staffing and working conditions improved, and we did survey that. That means that more than 2,000 nurses are ready to return if the Minnesota legislature takes action this year. So thank you to the Minnesota Senate for taking this important step, and nurses look forward to returning here soon for the Minnesota House vote. Thank you. I'm going to introduce John Welsh from Unity Hospital. Thank you.
Thanks, Becky. My name is John Welsh, and I'm a nurse at Unity Hospital, where I work on their cardiac floor. I'm really excited to be here today to talk about keeping nurses at the Bedside Act. This legislation is so critical right now for Minnesotans. Our hospitals are in crisis. Too many nurses are leaving the profession, and while the hospitals claims this proposal will mean less care for patients, the reality is the opposite. This proposal, if enacted, will make sure that our most vulnerable patients receive the attention they need from nurses. The nurses here love our jobs. We love working with patients and their families. But there are too many days where we cannot provide a safe level of care. We aren't asking for our jobs to be any easier. We are asking to be able to provide a level of care that we would want for our loved ones. My shift yesterday offers just an example of what we're facing. Three of my 4 patients were in decent shape. They were going to be discharged later in the day, but they still needed care. They needed labs, they needed pain meds, they needed help to the bathroom, they needed follow-up appointments. Nothing high-tech, just basic nursing care so that we could avoid them coming back into the hospital because of something we could foresee, and just avoid that. Just basic nursing care, but it takes time to do it right. In the meantime, I had a 4th patient who was suffering. She was in her 90s and had a respiratory illness that was very significant. You could hear her breathing from the hallway, and her weak but frequent cough made her whole face squint in pain each time she coughed. On Monday, when I had her, she was eating lemon ices and broth. On Tuesday, she didn't eat the entire shift, and she only could drink water with me coaxing her and having her swallow her pills with large amounts of pudding. These are our most vulnerable patients, but they're not getting the care they need. Too often, we are just simply too busy. My patient's condition yesterday did not worsen significantly during my shift, and I thank God for that. But I do know it could have worsened, and such patients often do deteriorate. The helplessness you feel as a nurse when you aren't spending the time with your sickest patients is one of the most distressing parts of nursing today. It drives nurses out of the profession. And most importantly, it harms patients. Last year, the Minnesota Department of Health reported a large increase in adverse events for patients, pressure ulcers, falls. Those are directly tied to nursing care. Nursing research looks at these issues, and they use big terms like moral injury or failure to rescue. But nurses just know as simply as it is. Chronic understaffing, that means we cannot give the patients that we care for the level of care we need to provide, the level of care that made us want to be nurses. The aim of keeping nurses at the Bedside Act is simple. Improve our staffing crisis in a meaningful way, and nurses will stay on the job. And those who have left may actually return. But the ultimate goal isn't about the nurse. It's about the patient. It's about providing safe care to our state's sickest and most vulnerable people and providing the care they deserve. Thanks for coming, and the next person I want to introduce is Ursula.
Thank you. My name is Ursula Claren, and I'm a labor and delivery nurse and a charge nurse at the Mother-Baby Center at Abbott Northwestern Hospital in South Minneapolis. Right now, our country is facing and obstetric and newborn health care disparities in this country, and also right here in Minnesota. And research shows that proper nurse staffing with a diverse workforce can help reduce these disparities. While working in labor and delivery for nearly 8 years, like many of my coworkers, I have acquired a list of skill sets and years of experience and can care for the medically complex birthing patients and their newborns. Babies are born at any time of the day and sometimes can be very stressful and chaotic on a high-risk unit such as mine. As a charge nurse, I'm a leader for our nursing staff. I coordinate emergencies, match the nursing skill level to patient acuity, but changes can occur with little to no warning. In a matter of seconds, I need to be able to support my staff in their care of their patients. Taking nursing out of staffing decisions increases patient risks significantly. We continue to assess pregnant patients during their labor and hospitalization for complications. It takes years to hone these skills. Many of us experienced nurses are denied vacation hours because of these specialized skill sets, yet our voices asking to be included in safe staffing committees are denied. Every unit and facility is different and requires different care models and protocols. This cannot be a one-size-fits-all approach, which is why we need to be at the bedside and be a foundation in safe staffing committees. Increasing the load onto nurses' backs by means of continued unsafe staffing, on top of the pandemic, complex patient care, caring for our families, and fighting to heal our communities will break every single one of us. Please help us care for our patients safely by giving us a voice and safe staffing in our hospitals. Please pass this bill with safe staffing provisions from keeping Nurses at the Bedside Act included. Thank you.
Thank you to all the nurses who spoke, and now it is my honor to bring up Senator Nurse Erin Murphy. I'm Erin Murphy. I am a registered nurse and a member of the Minnesota Senate, and today we're going to debate and pass the Keeping the Nurses at the Bedside Act. This is more than a decades-long fight, and nurses have been saying over and over again that they want to take care of patients. They want to do it safely. They want to do it with the professionalism and the skill that they know is required to care for the patients that are Minnesotans. I want that too. I couldn't be more proud to stand with this crew representing the nurses all across the state who have fought for this. It's time to listen to the nurses, to understand that if we want to keep nurses at the bedside, we have to give them the tools to make sure that they can lead and do the job that they are providing with the skill, the professionalism, and the dignity that they deserve. Today we're going to get this done. Thank you very much.
She's our hero. Let's hear for Erin.
Questions? How can you follow that? Seriously.
Just remind me, this bill, this version of the bill doesn't have specific numbers listed.
Nope.
Just creates the committees, makes sure nurses won't.
That is correct. I don't even think ratio is even in the bill. I don't even think that word is even used. It is forming a committee that the nurses would be 35% of that. The other 15% would be other healthcare workers, lab, nursing assistants, etc. So in what universe is 35% the majority? Okay? And so it is giving us a seat at the table to be able to professionally do what we have a right to do, and that's to advocate for our patients. So, thank you for asking that. Yep.
What do managers say when you tell them you can't take care of everybody that's on that you just can't stretch yourself farther?
You pray? Is that what she's saying over there? Yeah, you pray. You know what I worry the most about The more senior nurse you are, the more potentially assertive you get to fight for your rights of your profession and your patients. What I worry about is the new generations of nurses that don't have the experience to be able to, or don't know that they shouldn't be taking care of the loads. That's what worries me. And that's why our nurses go home feeling unsafe and leaving the profession after only a couple years. I've had so many nurses in the last couple, throughout the pandemic, but even before that, literally crying on my shoulder because this isn't what they went to school for. This isn't what they expected, and they don't feel that they can do it. And they've only been in a couple years. So that's got to change. That's what we're trying to do here. Change that.
Anyone else? Ursula, John, Becky, how managers react when you tell them you're understaffed?
I think how managers react is, they want to try to get the unit to be open as much as possible and take care of patients, and this is something that we want to do too. We really want to do it safely, and I think when we are stressed, we're dealing with complex patients, and our patients are getting more complex as it is. And then on top of that, a lot of social issues that are happening with our families as well. It's really hard to try to load that on somebody else's back even more when they're already stressed. And nurses I'm seeing, they are taking more time off or taking ill calls or whatever because they just can't deal with the stress of it. And I understand that. I myself have dropped my hours down during the pandemic so I could take care of my kids. And, but also because it was stressful. It was super stressful. Every single day there was a change. And so all we're just asking is for a voice and a seat at the table. That's all we want. And I think our voices we need to be heard. So, thank you. Thanks.
Is that it?